Hello, good morning everyone. This is me Anusha Karki. I'm going to present my change process topic on enhancing medication administration. On introduction, why is the change necessary? As medication administration is an important part of the healthcare process, errors in medication can cause substantial injury to patients, including disability and death. Changes in medication delivery are required to improve patient safety, healthcare efficiency, enhance compliance, and outcomes, focusing more on patient centered care. What will happen if change is not implemented? Many following consequences may occur, like increased medication errors, wasted resources, lack of accountability, insufficiency, etc. Characteristics of the change make it innovative, like utilizing technology such as electronic health records, tailoring medication administration to individual patient needs and preferences, promoting patient-centered care, ongoing evaluation and adaptation, compliance with best practices and safety measures into the change, reducing the risk of medication errors. Following more, we are also talking about models like enhancing medication administration in a healthcare setting is a crucial aspect of patient safety and care quality. So I have chosen ADKR change management model to successfully implement change in this process. Like awareness, ensure that all stakeholders are aware of the needs for change in medication administration process. That will help and emphasize the risks and challenges associated with medication errors. And also desires, encourage the desire for change by explaining the advantages and results of the new strategy. It will help on emphasizing streamlining workflows and improving patient safety. Modules, again on following like knowledge, provide training and education on the new medication administration procedures to equip staff with the necessary knowledge, ability, support staff in acquiring the knowledge and skill necessary to implement the new processes through practical training, simulation and mentoring. Reinforcement, create a system of rewards and recognition to sustain the change and ensure that it becomes a part of the organizational culture. Going forward, we will also talk about skills required for leaders and change agents, as it is important for the leaders and change agents to develop and implement their skills for the change, like clinical knowledge, a deep level of understanding of medication administration process, pharmacological and practices in patient safety is vital. Communication skill, as leader and change agent must be able to effectively convey the vision for change and develop a strategic plan to achieve their goals with effective communication skills. Problem solving skills, like they have must be able to recognize and address issues related to medication errors. Leaders must be skilled at critical thinking and decision making about change process improvement. We also have like leaders must also have the skills like flexibility and adaptability, like they are helped to adapt their plans as needed, open to new ideas and willing to embrace change. Furthermore, skills required for leaders also contains collaborations, fostering a cooperative and respectful culture while working together with interdisciplinary teams is crucial. Regulatory compliance, extensive knowledge of healthcare rules, quality standards, and patient safety guidelines is necessary. Education and training is necessary. Time management to balance various aspects of leadership and change management. Continuous improvement and reviewing and improving drug administration procedures in order to adjust to new best practices and requirements. Moving forward, we will also talk about communicating change to stakeholders, like in a variety of ways. Identify stakeholders engaged in the administration of medications, such as medical professionals, nurses, patients, and family members. Provide training and education sessions to healthcare providers and staff. Develop clear and consistent communication about the changes to medication administration. Conduct interactive workshops and questions answer sessions to address questions and concerns from stakeholders. This will help in better understanding of the change. Continuously assess and improve the communication strategy and the changes in medication administration. Furthermore, we will also talk about the barriers in the change process, like resistance to change. Due to concerns about increased effort on familiar technology or a fear of errors, healthcare professional and staff may be have to adopt new drug and management practices. Cost restriction, it is expensive and healthcare organization release, can be committed to provide the required funds. Lack of resources, the chains may require additional resources such as staff training, equipment, or technology. Patient resistant to drug regimen, this may include new technology or more personal responsibility for the leaders. Regulatory compliance, it can be difficult and time consuming to meet regulatory standards for drug management. For the enablers of the chains, it will be improve patient safety, comprehensive training and support for staff, improve efficiency and reduces administrative tasks. Clinical decision support helps in making informed medications decisions. Resistance for the change, fear of change, lack of trust in leadership, communication, education, and training, established feedback mechanisms. Like furthermore, we will also talk about the resistance of the change. To minimize disturbance to regular activities, introduce changes gradually rather than all at once. Develop contingency plans to address issues that may arise during the transitions. Manage additional workload during the transitional phase. Take into account temporary workforce alternatives. Keep all stakeholders informed and well trained throughout the process to reduce confusion and disruption. Now we will also talk about evaluation of change process. We have to first define clear and measurable objectives for the change. Collect data including medication error rates, patient satisfaction levels, staff compliance with new procedures, patient outcomes, staff satisfaction, and cost saving. Analyze the difference to understand the effectiveness of the change. Gather feedback from various stakeholders that will help and provide clear idea into the change impact on the medication administration process. Confirm the new procedures are being followed appropriately. Evaluate the medication administration procedures on a regular basis. Implement long-term change sustaining strategies include continued training, frequent performance assistance, and feedback loops. Indicators for successful change: decrease in medication errors, improved adherence to developed medication administration protocols and guidelines, high level of staff satisfaction and confidence in medication administration procedures, fewer adverse reactions, positive patient outcomes, reduced hospitalization and cost, enhanced communication, compliance with meeting regular requirements and standards. Furthermore, we will also talk about unsuccessful change, regarding unsuccessful change, it will be increased medication errors, low staff adherence, poor staff satisfaction, persistent patient safety issues, increased cost and hospitalization, lack of communication, insufficient training and education, failure to meet regulatory requirements from this change. And we will also talk about references. These are the references I have taken. These are the references I have taken as a reference for my change process on enhancing medication administration.